வணக்கம், குட் மார்னிங். என் பெயர் டாக்டர் பிரபாகர். இந்த வீடியோவில் we are going to discuss about the hemostasis and coagulation mechanism. Hemostasis and blood coagulation is the important university long question from the hematology. So in the exams you have to write the answer with the suitable diagram. So in this topic give the brief concept about the hemostasis and blood coagulation mechanism. So we will go to the topic. Homeostasis means arrest of bleeding. This term similar to homeostasis. Don't confuse it. Homeostasis is maintenance of internal environment. The bleeding occur after injury or any pathological conditions. The arrest of bleeding having important steps. Vasoconstriction is the first important step for the arrest of bleeding. Then platelet plug formation, clot formation or coagulation mechanism, clot retraction and fibrinolysis. These are the important steps of hemostasis. Before going to the hemostatic mechanism, we must know the idea about how the fluid state of the blood is maintained. So inside the vascular endothelium, this is the vascular endothelium. So the vascular endothelium releases the nitric oxide and prostaglandin I2. This nitric oxide and prostaglandin I2 inactivate the platelets. This is the one mechanism maintain the fluid nature of the blood. Another one mechanism is the heparin sulfate, the natural anticoagulant located in the luminal surface. It binds with the antithrombin 3. Antithrombin 3 inactivate the coagulation factor 2, 9 and 5. So this mechanism also helpful to maintain the fluid nature of the blood. The third mechanism is the thrombomodulin that bind with the thrombin. It activate the protein C activators. So inactive protein C is converted to active protein C. This inhibits the coagulation factor 5 and 8. This is also important mechanism for maintaining the normal fluid nature of the blood. Okay, so this mechanisms helpful to flowing the blood within the vascular system. Vasoconstriction is the first important protective mechanism against the bleeding. So this image shows one wall of the vascular endothelium. Beneath the endothelium collagen layer is there, and beneath the collagen the smooth muscle layer is there. So during the injury, the endothelium and collagen smooth muscles are damaged. So the vasoconstriction is occur due to the release of endothelin from the vascular endothelium. That endothelin produces a smooth muscle contraction. This is the one mechanism. Another one mechanism is the inflammatory mediators is produced due to the injury. Inflammatory mediators like leukotrienes, histamine it acts on the nociceptors. These are the nociceptors. These nociceptors produces the vasoconstriction of the smooth muscles. Smooth muscle contraction, it produces the vasoconstriction, decreases the loss of blood. Another one mechanism is the myogenic mechanisms. The direct injury of the smooth muscles or stretching of the smooth muscles produces the contraction, stretch induced contraction, that is called as the myogenic mechanism. This is also produces the vasoconstriction. So endothelium, nociceptor, myogenic mechanism, these three things involved in the vasoconstriction. Platelet aggregation is the second step of hemostasis. So the temporary platelet blood formation, it is divided into the three steps: platelet adhesion, aggregation and agglutination. So after the injury, platelet is sticky nature. So platelet is attached, seal the injured site by the platelet is attached with the von Willebrand factor. This is the von Willebrand factor. The von Willebrand factor attached with the platelet by the binding protein, that is called as the glycoprotein 1b. The platelet attached with the von Willebrand factor with the glycoprotein 1b. So and each platelet is attached by the glycoprotein 2b and 3a. So this glycoprotein 2b and 3a inhibitor used for the prevent the platelet aggregation for the stroke MI patient. That is drug name is the abiximab, that is inhibit the glycoprotein 2b and 3a. And endothelial vascular endothelium produces ADP and thromboxane A2 that stimulate the platelet aggregation in the injured site. And thromboxane A2 and serotonin, it produces the smooth muscle contraction, produces the vasoconstriction. The ADP receptor inhibitor is used for the stroke MI patient. The drug name is the clopidogrel, that commonly used for the antiplatelet therapy. And thromboxane A2 inhibitor is aspirin, that is also used for the antiplatelet therapy. Okay. So the platelet adhesion is due to the von Willebrand factor and glycoprotein 1b, and aggregation is due to the ADP and thromboxane A2 that form the temporary platelet plug formation. Coagulation factors are proteins present in the blood and tissue fluid. It is involved in the clot formation during the injury. The first clotting factor name is the fibrinogen. Second clotting factor is the prothrombin. Third clotting factor is the tissue thromboplastin. Fourth clotting factor is the calcium. Fifth clotting factor is the proacylarin or labile factor. Seventh coagulation factor is the proconvertin and stable factor. Sixth coagulation factor is absent. Eighth coagulation factor is the antihemobilic factor. Ninth coagulation factor is the Christmas factor. 10th coagulation factor is the Stewart-Fowler factor. 11th coagulation factor is the plasma thromboplastin antecedent PTA. 12th coagulation factor is the Hedgeman factor, class factor or contact factor. 13th coagulation factor is the fibrin stabilization factor or Lagge-Loren factor. High molecular weight kininogen, otherwise called as the Fitzgerald factor. Prekallikrein, otherwise called as the Fletcher factor. Kallikrein, platelet phospholipids. These factors are involved in the clot formation. Coagulation of blood or clotting mechanism. It has two pathways, intrinsic pathway and extrinsic pathway. The intrinsic pathways start with the factor 12, activation of the factor 12 to 12A. The 12A activate the 11 to 11A. The 11A activate the 9 to 9A. The 9A with the help of 8A, it activates the 10 to 10A. With the help of factor 5 and calcium, it converts the factor 2 prothrombin to prothrombin 2A by prothrombin activator. This prothrombin 2A convert the soluble fibrinogen to fibrin with the help of fibrin stabilization factor, factor 13. So it forms the fibrin clot. This is the intrinsic pathway. It will take 4 to 6 minutes due to the damage of the vascular endothelium. It produces the intrinsic pathway. The extrinsic pathway is the shortest pathway. They occur within the 20 to 30 seconds. It is due to the release of factor 3 or tissue factor. It activates the 7 to 7A. The 7A activates the factor 10. 3 plus 7, 10. So it from 10 it is same common pathway for the intrinsic and the extrinsic pathway. 10 is converted to the 10A with the help of factor 5 and calcium and factor 8. It produces the 2 to 2A. 2A convert the fibrinogen to fibrin with the help of fibrin stabilization factor. So this is the common pathway. 10 to fibrin formation is the common pathway. So the difference is here only for the intrinsic and the extrinsic. Clot retraction is the important process after the clot formation. It is important for the healing wound. So the platelet contraction try to heal the vascular endothelium. It seals the damaged endothelium. It is also releases the platelet derived growth factor from the platelets. It produces the collagen regeneration for the damaged collagen and smooth muscle proliferation for the damaged smooth muscles, and vascular endothelial growth factor. It acts on the vascular endothelium for the wound healing. Fibrinolysis is the important step after the clot formation. Otherwise, small clot occlude the blood vessels. So it produces the ischemia. So this is the important step after the clot formation. The fibrinosis is initiated by the tissue plasminogen activator. It is present in the luminal surface of the vascular endothelium. It converts the plasminogen to plasmin. So this plasmin is degrade the fibrin clots, insoluble fibrin to the soluble fibrinogen. So that time increases the D dimer. Summary of hemostasis. Hemostasis is the arrest of bleeding. It has important steps. Vasoconstriction is due to the endothelin nociceptor myogenic mechanism. Platelet plug formation mainly due to the one villefrant factor, glycoprotein 1b, glycoprotein 2b and 3a, ADP, thromboxane A2. Clotting factors helpful for the clot formation. Clot retraction is occurred due to the platelet contraction, platelet derived growth factor, vascular endothelial growth factor. Fibrinolysin occurs due to the formation of the plasmin. Thank you for watching this video. Those who are not subscribed the channel, please subscribe. Thank you once again.